My name is Joy Henderson, and I am from SkillSprout. I work in the Champaign Clinic in Champaign, Illinois, and I'm talking today to Samantha Dunlap, who is a board-certified behavioral therapist who works with SkillSprout in our Texas region. Good morning,
Hi,
Sam.
Joy. Thanks for having me.
Great, and we're talking across the miles here. Sam, I wanted to talk to you a little bit today about what you think sets Sprout apart from other providers. And we know there's a lot of other providers that parents, when they first get a diagnosis of autism spectrum disorder or another developmental disability, they'll go out there and start looking around. What would you say sets us apart from other companies that offer these services?
Well, when a child first gets diagnosed, the parents might not be familiar with all the different types of therapies that can be offered to help them. So it can be a little overwhelming because they might say, okay, you need ABA, you need speech, you need OT. Well, what SkillSprout does is we have that all in one place. So we created a transdisciplinary approach where, the child will get all the services they need, and then also the providers collaborate with each other to make sure that their goals are set to make them as successful as possible.
Okay, so they're going to be getting intensive ABA, direct ABA, and then there's also possibility they might need occupational therapy, speech, parent training, mental health services, and all those can be provided in one place, which, as you said, that's pretty convenient. That's great. So, so how do we decide, besides maybe the diagnosis or, what kinds of specific opportunities the parents might have for reaching out for services, but how is it decided where and when we should start offering these services? Is there a process for that?
So we do have a pretty intensive intake process where part of the assessment with the clinicians is just part of it. So we also have clinical case coordinators that are very unique to SkillSprout. They'll do a very intensive intake process, find out what the parents' priorities are, find out where the child currently is, set the clinicians up for success when they do the assessments. And then after the assessments are done, it's a lot of specific training to make sure that we recommend the right placement for the child. So if it's something where we really need to change the environment around a lot before the child even gets there, the clinic might be more appropriate. And then we can generalize those to the home setting as well.
That's fantastic. So we're going to be working as a team with the parents. We're going to include clinicians and, also teachers, other members of the child's life.
Oh, yes, absolutely. So we make sure as clinicians to coordinate with everybody that's involved in that child's progress. So that might be teachers, it could be another provider outside of SkillSprout, the parents as a primary focus to really make sure that this is a team approach and it's not just a clinician saying everything, this is how we're going to do it. We really want it to be team centered.
And so it's unique to the child. And is there something that we put together specifically for each child? Can you tell me a little bit about that?
Yeah, so the one part of the assessment process is the care map, which is the care measurable action plan. So the clinical case coordinators will complete this and they'll go over what the parents' priorities are for their child. So these are kind of long-term overarching goals that will lead some of our treatment planning as well. So clinicians look at those as, okay, I need to make sure that some of my goals fit in here as well to make sure that we're really not just meeting the needs of the child, but meeting the needs of the family as well.
Oh, that's really cool. It's a whole family approach. Is there a place that the parents will be able to monitor this? Is that another thing that sets us apart?
So,
Okay.
yes, we have an online database where they'll actually be able to see all of their child's programming, all of their data, They can even look at billing on there. So
Wow.
really convenient online spot where everything is, that they can monitor. And then also it will be reviewed how to look at this, how to tell if a child's progressing on certain things, in parent trainings with the clinicians as well.
Wow. So it sounds to me like, you're telling me that there's several ways that SkillSprout is different from other providers in that transdisciplinary approach, in the development of a specific plan for each child called the care map, and that's involved in that intake process, the team environment approach, and that parents can even have a bird's eye view of what's happening with their child during their therapy. That's fantastic. Great.
Yeah, it really is, key for parents to know exactly what's going on. So it's great that they have that opportunity.
Great. Well, thank you, Sam. And I know we're going to be talking a little bit more about some specific programs, but we're going to go ahead and end this now. Thank you again.
All right. Thank